Thank you for joining today's webinar introducing the Care Coordination Collaborative Model. If you have any questions during the webinar, please submit them via the messaging feature on your webinar panel or raise your hand by pressing the button on your webinar. We will have an opportunity for questions at the end of the presentations. We will begin with an introduction by Dr. Paul Dworkin, Executive Vice President for Community Child Health at Connecticut Children's Medical Center and Founding Director of Help Me Grow National. Dr. Dworkin?
Thanks, Sarah, and good afternoon, everyone, and thank you all so much for joining this webinar. So all of you who are affiliates of the Help Me Grow National Center know that data collection is one of our core components. And the reason that we place such an emphasis on data collection is to both be able to answer the question, what is Help Me Grow doing, either at the level of the affiliate or rolling up to the level of the National Center, and secondly, because we're committed to gathering data to identify where the gaps, where the capacity issues are, and to use that data to inform our advocacy in system building. And many of you also know, because we've repeatedly emphasized the extent to which we were really stunned to initially find, based on our data collection, that the average number of contacts required to link the identified vulnerable young child and family to community-based programs and services on average is 7. And that has caused us to repeatedly ask a question, somewhat rhetorically, where does the care coordination capacity exist within our systems, recognizing that it really doesn't exist, and yet, given its critical importance, we need to build it. So this focus on care coordination really encouraged our efforts to look around and see what represented best practices and how we could best strengthen care coordination in the spirit of system building. And we would, as we would pose this question, we would present our admittedly somewhat jaded, tongue-in-cheek portrayal of care coordination as 3 care coordinators from 3 different programs arriving on the same doorstep looking for the same family who relocated 2 weeks ago, expecting to get chuckles, but all too often being met by heads nodding in an affirmative direction. So we earnestly began to look at more comprehensive models worthy of consideration, and there are a number of them out there across the country. I offer just 2 to reference: the Community Care of North Carolina and the California Community Care Coordination Collaborative, funded by the Lucille Packard Foundation for Children's Health and supported by our good friend Ed Shore. So on the basis of our knowledge of what was out there in terms of best practices and the urgent need to strengthen care coordination capacity based on our experiences within Help Me Grow, we began work with our state Department of Public Health Title V Children with Special Health Care Needs grant-funded regional care coordination entity, which at Connecticut Children's Medical Center is referred to as the Special Kids Support Center, to think about how we could strengthen and expand care coordination capacity in support of children's healthy development. Our Special Kids Support Center really served and has continued to serve as the backbone organization, and as you will hear, invited a broad array of care coordinators and their agencies to join the Care Coordination Collaborative, and if you will, rub shoulders at the table, including, by the way, Help Me Grow and Child Development Infoline. And as you will hear in more detail, the goals of the collaborative include sharing activities, priorities, and capacities across care coordination entities, encouraging synergy, cooperation, and minimizing redundancy and duplication, and also engaging in collaborative problem solving, both around common issues and even the needs of shared families. There are 2 very distinguishing features of this model that sets it apart from other initiatives across the country. The first is that its focus includes but extends beyond children with special health care needs to all children with a special focus on those who are vulnerable and at risk. And secondly, care coordination activities and engaged agencies are involved across multiple sectors, certainly from the child health sector, and not surprisingly from those sectors closely related to child health, including early care and education, family support, and child welfare, but also some less obvious but equally relevant sectors: food and nutrition, housing, neighborhood health and safety, and transportation, and even the potential for engaging more distant sectors, also critically important to family well-being, including economic development, workforce development, and employment. The success of the Hartford Care Coordination Collaborative has had really stunningly profound implications at both the state and the national levels. As a result of the success of this Hartford pilot, our Connecticut Department of Public Health now requires that all 5 regions of the state emulate Hartford in expanding regional Title V care coordination entities to create care coordination collaboratives. And we in the National Center are extremely fortunate to have the support and funding of the W.K. Kellogg Foundation to enable us to provide technical assistance to our affiliates to enable dissemination of the Care Coordination Collaborative model across the nation. So the goals of this webinar are to increase your familiarity with the Care Coordination Collaborative model and enable your informed consideration of participating in its national diffusion. I must admit also that my personal enthusiasm certainly includes the Care Coordination Collaborative model itself, but even extends beyond the model, in that this really epitomizes our commitment to system building in support of young children's healthy development. It demonstrates the importance of data collection and even the feasibility of addressing gaps and capacity issues. And secondly, it demonstrates the utility of our vibrant, engaged, committed affiliate network within the diffusion of innovation arena.
Thank you, Paul. This is Joanna Bogan, and we are going to now talk about our agenda. And I just want to remind everybody, if you have any questions, please type in the chat area, and we will look at doing questions after the presenters have presented. So today we're going to look at describing what a care coordination collaborative is and how it can enhance your Help Me Grow system, and how you can assess the feasibility of establishing a care coordination collaborative within your system. Our presenters today are Lisa Honigfeld, Mary Jane Carey, and Susan Roman, and they are providing the technical assistance and consultation for this innovation. And we are going to have them introduce themselves as they begin to talk about each of the areas. Lisa?
Thank you, Joanna. I think what I want to do right off the bat is just reiterate a point that Paul made, that is really underlies the Care Coordination Collaborative model, and that is there are a lot of people out there coordinating care. And unfortunately, they they struggle with families, and they struggle in doing their jobs well. And one of the things that you'll hear about is that we have been able to really, on the backbone of Help Me Grow, and by using the Help Me Grow system, we've actually been able to support care coordinators across a variety of systems and at the same time strengthen Help Me Grow. One of the things, simultaneously, when we were looking at care coordination models and thinking about ways to expand the impact of Help Me Grow here in Connecticut, at the same time there was a trend towards medical home and transforming pediatric primary care sites into medical home. And so I'm sure you've all heard that term, and you don't have to read very far into the medical home literature to understand that care coordination is really a central component of medical home. as we looked at that here in Connecticut, one of the first things we realized is that pediatric primary care sites interested in medical home did not know all of the resources out there and badly needed care coordinators to help them connect kids to resources. And they couldn't just hire a care coordinator because they couldn't find somebody who knew all the resources out there. It was a real boom to this work to have our Help Me Grow system and to have Child Development Info Line to swoop in and fill that gap immediately. The other thing, and Paul mentioned this, is that no matter how much practices thought they were doing care coordination or that other sectors thought they were doing care coordination, and Paul mentioned several of them, child welfare system, I'm going to talk about a few others, no matter how much families still weren't getting connected to services. So this was really an area that was made for Help Me Grow to come in and to start partnering with others doing care coordination. At that same time, we had managed care here in Connecticut. We had Medicaid managed care. I think we're probably the only state that no longer does. But we had pre-managed care companies, and you know what? They all had care coordinators, and they were all trying to help practices coordinate care. They were all trying to help families, and they were they didn't know all the resources available. So we were able, as we started to build this model, to offer our Help Me Grow system and Child Development Info Line to do that for them. We also had a dental and a mental health carve-out programs that had care coordinators. These were other folks who were always looking for services for the families they were serving, the children they were serving, and really did not have a handle on all the opportunities for children and families out there. So again, it was a great partnership with Help Me Grow and with Child Development Info Line to help these other sectors meet their care coordination needs. And then Paul's also already talked about our Children Youth with Special Health Care Needs program here in Connecticut, which includes 5 regional, and they are called care coordination centers. Interestingly, these 5 centers were probably better connected to Child Development Info Line and to Help Me Grow services than all the others. So it really did make a lot of sense to build this care coordination collaborative on the backbone of our Special Kids Support Center here at Hartford. The Hartford Care Coordination Collaborative really just started with bringing together in one room care coordinators from child welfare, at that time we had managed care, from the dental and mental health carve-out programs, from children youth with special health care needs. And one of the most, I love this story. We started out having all the organizations represented tell what they did for care coordination. And everybody, we took more than one meeting. Everybody said, this is what we do. And you would think that every family got connected to every service, and there were no problems. Mary Jane's laughing over here. It was amazing that you start thinking, well, what's the problem? Everybody's doing really well out there. So then we said, well, let's try a couple case reviews then. And with one difficult, complicated case about a child who needed a lot of services, we started realizing that all these care coordinators knew very little about all the services out there. And I think that that's been one of the real strong points of the Care Coordination Collaborative, that we have been able to really bring up and help care coordinators from a variety of sectors do their job better. And I think they appreciate that, and I think that's why participation has been so excellent. So with that, I'm going to ask Mary Jane to tell you a little bit about our experience in Hartford and beyond.
So this is Mary Jane Carey, and I'm a consultant that works with the National Help Me Grow Center and has been very involved with Susan Roman in creating the Hartford Care Coordination Collaborative, which started in 2010, and it was really, as Lisa described, all the things happening in the world of medical home. It was really her comment and suggestion about what do you think about bringing some care coordinators together and seeing if we can't maximize the resources that all are providing and make the system more user-friendly for families? And we pulled people together. The director of Child Development Infoline, Karina Duplessis, Susan Roman, and I reluctantly pulled people together and thinking, I'm not sure how this is going to work, and continued from the beginning up till now and moving forward, have been really so surprised and pleased with the results of this effort. It has been a really incredibly rich experience. People seem to feel like needs are being met, and I think the Care Coordination Collaborative, and we'll talk about this a little bit more, is something unique that is not being offered through other collaboratives or networks or groups that are meeting. We seem to have found the balance between meeting needs on a family and care coordinator level and also looking at some policy issues that have been identified and we'd like to bring to those who would be interested in hearing what we're finding and hopefully make some changes. So we started with our Hartford Area Care Coordination Collaborative. It's one of 5 regions in the state. It covers, I think, 37 communities. And again, it's been operating since 2010. We have a lot of people coming to the meetings, and the director of Children and Youth with Special Health Care Needs really saw the value of this, and as he started thinking about how the other regions can really take advantage of all the resources that are out there for families, I think the recognition is that no one can do everything that a family needs on their own, and they shouldn't, because there's too many other resources and services available, and the ability to connect those people to each other to take advantage of the full range of services was something that had a great deal of appeal to him. So he decided to take the model that we have in Hartford and have it replicated in the 4 remaining regions, so that we will actually have a statewide expansion. We're in the process of doing that now. And what we've added to that statewide expansion is, in addition to the 5 regions that will be operating, we're also creating a state-level collaborative, and that will have representatives from each region and really look at the policy and systems issues on a state level and really identify the policymakers and the stakeholders and other people who should be interested in hearing what we're experiencing on a regional level, with the idea that we hopefully can make statewide systems changes. So while we're moving forward and expanding to a statewide system, we're also expanding in another way. As we said, the Hartford region has 37 communities, and a number of people who work locally have heard about the collaborative and are very interested in taking advantage of these meetings and the work that's generated through these meetings, the information that's shared, the trainings that we do. And we're trying to find a way, and I think we have found a way, how do we accommodate everybody? We obviously can't have everybody from every community, but we're piloting with one of our communities, the town of Vernon, actually has asked to officially be represented on the collaborative, and they have a group in Vernon that meets, and they really have recognized that what the collaborative can do is bring much more richness to the issues that they deal with. So we now have 2 people who are rotating and coming to the Collaborative on a regular basis and are serving as the conduit to go back and bring the information to the Vernon group. We have made arrangements and decided that if they have cases that they want presented to the Collaborative, we certainly would have them come and see what we could do to help them. And any trainings that are identified that we bring in somebody to do training on a substantive issue that's been identified as a need we all have, we would open that training up and invite the Vernon folks as well. We think this is a model. We're going to look at doing it in Hartford and some of the other communities in the regional area of Hartford, and we'll offer this as a possibility for the other regional collaboratives that are in various stages of getting started. So it's exciting. I think I am going to talk about lessons learned. What we found, what I've always believed, and it's certainly true here, is that everything is relational. And the collaboratives we found have really strengthened and reinforces relationships. The synergy that drives the flow of the collaborative is amazing. We just kind of move from case presentations that identify areas that members really feel like they need more information and more training, and the cases really are very good at identifying on a very practical level what the policy gaps and barriers are, so that we have information that we can then in a very concrete way take to policymakers and legislators that is supported by the experience of the folks who are actually dealing with the families. We have found a resource. It's the Partners Tool, and I think some of you may be familiar with it. We've talked about it in the past, and we'll be doing more work on that, and I think Susan will just mention it. We try to find a way to measure what we're doing. We kept saying that, you know, people really enjoy coming to these meetings. We get very good numbers of people coming. We always joke that it's on a Friday afternoon from 2 to 3:30, and yet people still come. And so something good is happening there, but we didn't know how to get our hands around it. And we found that the Partners Tool is a resource that helps us measure what is going on with the collaborative and the strengths of the relationships and how we're doing and what really all the strengths are of the collaborative, but also where we need to do some work. And the results of doing the Partners Tool resulted in identifying that one of the things we were not good at was collecting data on the information. And of course, we've all recognized, and I think Paul's comments at the beginning of the webinar stressing how important the data are in really measuring the impact of what we do. And we think we're doing something good here, but that's just not good enough unless we measure it. So with the guidance from the Partners Tool and recognizing that that's an area we needed to do some work, we have started looking at how to measure them, how to measure the work we're doing, how to measure the impact, how it's affecting the people who are coming to the meetings, how it's affecting the families that they work with. And Susan has staff that have been involved in looking at the measurements and coming up with ways to actually measure in a very concrete way some of the things that we're doing, and we'll talk about that a little bit more. We also recognize that what was lacking in coming to the collaborative meetings, we have care coordinators, and we have people who are providing the care coordination services, but we also wanted to hear from the folks who needed care coordination. So we're looking to expand having the number of healthcare providers who can participate in these meetings and work with us directly about saying what their needs are and how we could best meet them. So those are the two areas that we're looking to grow a little bit. And with that, I am going to turn it over to Susan to talk about the micro and macro levels of this work.
Thank you, Mary Jane. Hello, everyone. My name is Susan Roman, and I'm very pleased to be here today with you. As Paul mentioned, I am the Program Director of Special Kids Support Center, and we are the regional care coordination entity for children and youth with special health care needs. So I'm sure you're all thinking about this another meeting, another group, and how is this going to be different from all of those other meetings and groups that we attend on a regular basis? Well, I think basically what sets the collaborative apart from the other group is its unique approach to care coordination. It's really a two-aimed approach, and I'm going to talk about the micro level and the macro level of the collaborative. At the micro level, we first are very important to support our families and our care coordinators. And in supporting care coordinators, I think you cannot underestimate the importance of providing network opportunities to people who have boots on the ground, who are doing all the hard work. It's very difficult sometimes to be able to get out of your offices and to work and talk with other people who are doing the same kind of work that you're doing. So I think that's one thing that is very important with coming together with the collaborative. Another way that we support care coordinators is by presentations. We have a lot of agencies at the table, as Mary Jane has said, and it's really important for people to talk about the kind of work that they do and the resources and services that they offer so that that can inform care coordinators on how to get the services that their families need. We also do trainings, and this is really important because so many things are changing in our state and in the nation with the Affordable Care Act and other types of legislation that comes through. But some of the trainings that we do talk about are trainings on SSI and protective factors, and these, again, really are important for the work that we do. There's a lot of resource sharing, and we also do a lot of case management where we help other care coordinators find the types of programs that their families need. We support the families by being able to know those resources and services in the community and being able to link to those entities. We also help our families by case presentations. So if a coordinator does come to the table with a very complex case, and I know I've done this in the past, and you're sort of hitting these barriers and not knowing where to turn, it's great to be able to bring this to my colleagues and to talk about what I'm facing and if anybody has any suggestions. And I would say, Mary Jane, that people really take a lot away from this, even if it isn't your case, that you are making notes about what you can bring back to your colleagues and how you might use that in the future. So that's really important. And the other way that we support through the micro level is the support of medical homes. And we do this by assisting providers with care coordination activities. So really, it's kind of a quiet, seamless process. The providers in the community really don't need to know what's going on in the collaborative, but the fact that they can have patient cases being brought to us and we can help solve some of their most unique problems. So they don't even know and don't even have to know what's going on. The other way we do support the medical home is through care coordinations is we help those providers that are going for NCQA status or the patient-centered medical home and by helping them with care coordination. And at the macro level, we help to identify programmatic and system-level barriers and share with policymakers and other stakeholders. So what does this mean? Really, we have an easier time identifying the issues that are facing our families and our care coordinators through our presentations and discussions. And I'm just going to give you an example of this. So as a result of the Newtown tragedy, the Department of Child and Family was charged by the General Assembly to develop a children's behavioral plan. The Department of Child and Family asked Lisa's agency, the Child Health and Development Institute, to assist with the development of the plan. CHDI solicited input from a diverse group of consumers, providers, and other stakeholders. Members of our collaborative saw this as an opportunity to share their experiences and the experiences of their families. We're able to identify systematic barriers to timely and appropriate care and offered recommendations to improve the provision of mental health services. We responded to the request for input, and much of our information was submitted was reflected in the final report submitted to DCF, to the General Assembly. So I would say that was really a good example and a great opportunity for us to help solve some of the biggest issues in our state.
Okay.
Back to Mary Jane.
I'm going to talk about if you're at a point now where you're intrigued by what Care Coordination Collaborative can do for your Help Me Grow system. And I have to say it is such a natural fit to the Help Me Grow system. It's just, it just makes so much sense in thinking about having something like this as part of your system. And if you're at a point now where you're really thinking this is something that you would be interested in exploring and working on, I'm going to talk about some of the things that you should think about. You know, really the concept makes a lot of sense. I think few would disagree with the concept, especially in its relationship to Help Me Grow. But the success is really dependent on relationships and trust that have to be the underpinnings of moving forward. So as you begin to think about this, the first thing that would make sense to do is to assess the need for a care coordination collaborative within the geographic area that you're thinking about starting one. Research what other groups are actually operating and working in your area. What's the purpose of the groups? What are the sponsoring organizations? What's their geographic scope? Who attends these meetings, and how often are the meetings held? It's just good basic background information to get kind of the lay of the land. What we have found as some of our additional regions in the state are starting their care coordination collaboratives. One region in particular, they did this. And they found that while there were many meetings, there was not a group that was really addressing the kind of issues that the Care Coordination Collaborative is trying to do. She couldn't find anybody or any group that was working on a micro and macro level. And I think that's part of the uniqueness of this group and this opportunity for you. You may find that there is a group that's close to doing this that you may want to partner with and suggest a way to work together. But you really need to know what is happening in the region that you're looking at and get a clear sense so that as you move forward in pulling the collaborative together, that you're aware of the other things that are going on. The other thing that we did in Hartford is prior to the first meeting, and Lisa talked about this a little bit, we actually did a survey and sent it out to the folks who had indicated that they were interested in the collaborative and that they would be coming to the first meeting. And we didn't ask them about the services they offered. We asked them more basic questions, you know, like how long do you keep a case open? What's the process for your referrals? After a case is closed, do you maintain contact with the family? Just background information that would help people connect dots as they were working with the different programs represented on the collaborative. The last question we asked was, what do you hope to accomplish through this collaborative? We compiled that information, and it was a great way to, it was a great agenda item for the first meeting because we had an opportunity to share the results and for people to look at it and to have a discussion on those issues. Another thing that you might want to think about in addition to surveying potential members or in lieu of that is to actually pull the data that your resource inventory has on the different programs that would be coming to the collaborative. Print it out and use it as a way for people to review the information and update it and share what's in that resource directory and how people can take advantage of the services. once once you identify potential members, you might want to think about who from those agencies would be the best person to represent that organization on the collaborative. And this is a little tricky, and I think part of the success for Hartford is you want care coordinators, but you also want managers. You want people who have one foot in direct service and one foot in management. And they tend to be the conduit for bringing the kind of information that would be helpful to people who are responsible for policy and programs within their organizations, but also have the feet on the ground experience of what it's like to be a care coordinator and work directly with families. So as we look at the potential list of collaborative members, think about the kind of person that you would want to see at the table of a collaborative. So if we, next slide. So some of the groups that you may want to think about, I think the call center, your centralized access point, really needs to be there. You want to look at primary health care providers. You want to look at early care and education programs. You certainly want your early intervention program to be represented. Your public health or health agency, your children and youth with special health care needs, certainly sharing with your children and youth with special health care needs programs the model that we have in Connecticut and the support we have from that group might be something helpful to share. Our Medicaid agency is very active on the collaborative, and all our carve-out agencies in Connecticut are represented. You certainly want to see parents involved in some way, either have a parent organization group or actual parents who can come, or if they can't come to the meeting, find a way to make sure that you have input from them. There's also advocacy organizations to think about, behavioral health, oral health, basic needs, legal aid, home visiting programs. I think anybody who's interested can really come up with a good brainstorming list about the groups and individuals within those groups who really provide the services that you're looking at within this care coordination collaborative. And as Paul said, I think expanding the group as you move forward and thinking creatively about other groups that may be interested in participating and providing some input and resources into the collaborative would be a good idea. Once you're ready to think about actually doing this, I think it's important to think about the infrastructure that would be needed for staffing and maintaining the collaborative. And I think it's interesting. It's really like Help Me Grow. The more Help Me Grow does, the more invisible it can be, because it's the infrastructure and the backbone that's kind of making all those systems connect and run, and you tend to kind of be, it's easy to be invisible. I think the same thing is true with the collaborative, that for it to run smoothly and effectively, it's very easy for the person or organization that's doing that to just do it and not be as visible. But you would have to think about who within your Help Me Grow system might be the ideal place to have the staff that would do this. It might be your call center. It might be the lead agency that's the leadership group, the sponsor of the leadership group. It might be a group that's already doing a lot of meetings, very well known in the community, could very easily figure out what meetings are already happening and how to pull a collaborative together. It certainly can be part of a person's job that already is doing much of this, but it does require getting the meetings organized, getting the agendas organized, keeping the information flowing, following up from meetings, there's a richness of material and information that's shared at meetings, and you want to make sure that that gets out to everybody. So it's basic maintenance, administrative maintenance of this group, and you have to think about it as you're thinking about the benefits of what a collaborative could bring to your Help Me Grow system. One of the things that you might want to think about is identifying some key people and either talking to them one-to-one or having an exploratory meeting with really some key partners to just get a sense of their interest and their support. It could be the first meeting you hold, or it could be before that. But I think you want to go into that first meeting knowing as much as possible that people are coming to the table because they do see some value in this and are interested in really exploring the option of doing it, and hopefully ending that first meeting with a consensus that this is a group that should continue to meet and move forward. So those are things to think about on how to get started and some ways to actually get started.
Thank you. This is Susan, and again I'm going to talk about what to consider in establishing and maintaining a care coordination collaborative, and I'm going to again talk about it at the micro level and the macro level. First, you want to think about how to plan and organize your meetings, and I would say Mary Jane is definitely the expert when it comes to planning and organizing our meetings. One of the things that we like to do is really to survey members on their topics of interest, because we really want this to be applicable to our care coordinators' work that they do. So when we look at trainings, when we look at presentations, and if we're going to talk about new policies, we really want this to impact the work that they're doing. We also want to measure the impact of collaborative efforts on members and their families with whom they work with. And we do this by doing case presentations. Again, this elicits feedback on cases and how families can be helped. We look at surveys, and when we look at these surveys, we want to know what works and what doesn't work, and how we can make adjustments to what we are doing. We look at linkages, and the most obvious one would be looking at the linkages with families, but we also like to look at linkages between collaborative members and linkages between members and non-members in our community, and I think this really speaks to the broader impact of the collaborative. Mary Jane briefly spoke about the Partners tool, and as you already know, it's a validated social network analysis tool. It assesses the quality of the collaborative partnerships. Mary Jane talked about one of the things that came out of the original survey that we did is that we did lack a data collection mechanism, and we have been working diligently on that. But what it really did show and demonstrated is our robust partnerships within the collaborative. We have a high density of connections among our members, a high level of centrality, and really most importantly, a high level of trust. At the micro level, you want to look at developing and maintaining processes for sharing information with policymakers and other key stakeholders. And we are in the early stages of convening a state-level collaborative. And this would include all 5 medical home regions and interested stakeholders. This will allow the regions to bring critical issues to the forefront and to collaborate on solutions for Connecticut's children. I also want to measure the impact of collaborative efforts on policy and system changes. And earlier I did speak about the Children's Behavioral Health Plan that we were able to provide input into. And I did want to share another example with you. So we're very fortunate in our collaborative to have an attorney from the Medical Legal Partnership program working with us. And it was during a training that she did on our medical carve-out for medical transportation. Medicaid carve-out for medical transportation. And she conducted a training on our medical cab system, and it was really basically how to negotiate services and advocate
for our families. But through this very robust discussion, it became clear that there were many issues with this system of care. And through this discussion, the collaborative members began to collect data from colleagues to facilitate change with the present transportation process, because we know how important this is for our families to access medical care.
Great. Thank you, Susan and Mary Jane. As was mentioned, the W.K. Kellogg Foundation has provided the National Center and the Office for Community Child Health the opportunity to provide technical assistance to affiliates interested in developing a care coordination collaborative such as this within their own Help Me Grow systems. And so we have outlined the next steps in participating in this learning collaborative. On Monday, March 9th, we will send an email to all the affiliate network with a request to submit a letter of interest by March 31st. And this letter, we will provide a template for submitting this letter, but it really needs to acknowledge these requirements, that the Help Me Grow centralized access point is operational and is a collaborative partner. The active participation in the monthly learning collaboratives, and the monthly learning collaboratives will include anything from webinars on important topics to group conference calls and materials, and also share lessons learned with the Help Me Grow National Center and other affiliates. In addition, collecting and reporting on identified measures. States that submit a letter of interest will then receive information on participation in the Care Coordination Learning Collaborative, and this will begin in June, including with the launch of a webinar, a training webinar scheduled to take place on June 11th. So at the end of this webinar, you will also have an opportunity to submit questions about the Care Coordination Collaborative, and also the technical assistance from the National Center and the Office for Community Child Health. And in the email to be sent out on March 9th, we will also include a recording of this webinar that you can then share with anyone that was not able to take part in today's webinar. We will now open up the line for some questions or comments. And again, if you do have a question that you would like to ask live, just raise your hand and we will be sure to unmute you. But we do have some questions.
Thank you, Sarah. So the first question came through. How do you deal with HIPAA issues? Mary Jane, do you want to?
Well, when we do case presentations, they're totally anonymous. So no family is ever identified. It's just basically the situation shared, and then people reacting to the needs.
Great, thank you. Another question is, are there any families on the collaborative?
The Family Support Network is really,
right.
Yeah.
This is Susan. We do not have any families per se on the collaborative. However, we do have the Connecticut Family Support Network, and the executive director of that network has a child with special needs, and there are several coordinators on the collaborative that also have children with special needs.
We really recognize that that's an area that we need to do a little bit better job. And one of the things we're thinking about is trying to find groups of parents that are already convened in meeting and going to them and asking them for their help and input as we continue to do our work. So, and I think for anybody who's thinking about creating a collaborative, really encourage you to try to think about how to pull families in from the beginning.
Great. Another question is, will we be able to use all of the surveys and partners tools that you have developed?
Yes.
Yes. We are putting together a manual, and we'll offer technical assistance on the partners tool.
And that manual will be presented on the June 11th webinar. Another question is, has it been difficult for the Hartford Care Coordination Collaborative to enlist agencies to commit to the collaborative?
Not at all. No.
No, and I think, ironically, one of the things that we have to do is ask people to contact us because we're running out of space.
Right.
So we can't have everybody come at this point.
This is why we are pleased with looking at forming these relationships with communities within the Hartford region, because we want everybody to take advantage of the collaborative, but it has to be manageable as far as size. There's a great deal of interest in the collaborative, and people want to come.
Great. Another question, how resource intensive is it to arrange monthly meetings?
I think it, once you have your rhythm about this, and if there's a place that you can meet all the time, and the rooms are set up and the process is in place, it's fairly easy. I'm assuming that some of the affiliates that are interested in doing this is not the same size as Connecticut, and that you might have to think about doing some things through conference calling, maybe having groups of people in different parts of the state meet and then getting on a conference call to be part of a larger collaborative. So I think those are all things that you would have to think about. And, there is some maintenance of effort in just getting the announcements out, keeping the contact list up to date, getting information out. It's certainly not hard. It's a time issue.
Another question from South Carolina. Does this collaborative require any funding to keep it going?
This is Lisa. We started the Hartford Care Coordination Collaborative with funding, and but I think having the startup under our belt and having and knowing what we know and having the tools developed that we've developed, it is less labor intensive and requires fewer dollars as a replication model. I think probably Mary Jane, who has started to work in other regions of the state, can attest to that. Do you agree, Mary Jane?
I do, and I think the collaboratives are being started under the auspices of the Children and Youth with Special Healthcare Needs grants. Staff, the leads of those programs have said that, we recognize that this is going to require some time and effort, and are really thinking about how best to do that. And some of the regions are large. One of them really feels like they're going to have two collaboratives operating. And in another region, they're actually looking at partnering with very well-established groups that are operating and already sanctioned by so many people that the idea of joining them makes more sense than starting a new one.
Great.
Can I just add one comment? This is Paul. I think the other issue around funding is this is not meant to be an add-on in terms of additional responsibilities for care coordinators. Rather, it's an opportunity to enhance effectiveness. And in our experience in general, once care coordination entities recognize this, they realize that it enables them to be more efficient and effective in what they are doing. In all honesty, that should not require extra funding. In fact, it should save dollars in the long run. And secondly, the opportunity, as we've always said, to blend financing. A good example is what Mary Jane mentioned about the use of our Title V dollars, although Title V dollars are specifically in support of children with special health care needs, but there's the opportunity to build out that infrastructure to also support other children and families. So some of the same creative, multifaceted funding strategies that enable Help Me Grow can also be applied to this innovation.
Great. Thank you, Paul. And I think we have one last question. Will the manual provide examples of agendas and meeting formats?
Yes.
Yes. Great. Okay, so I think that we have had all of our questions answered, and now we're going to ask Dr. Dworkin to give us a summary of the webinar.
Well, thanks, Joanna. I'll be very, very brief, but I do hope our goal here was to provide you with sufficient information to enable you to determine your interest in considering replicating the Care Coordination Collaborative. And just a couple of very quick thoughts. One is I think our speakers did capture the sort of elevator speech as to what this is all about. And if I were forced to do a one-floor elevator speech, it would be Care Coordination Collaboratives essentially coordinate the care coordinators. And that really is at its essence. Secondly, we're always pleased when innovations in system building reinforce critical concepts that we have found so useful in our Help Me Grow implementation and replication efforts. And I'd offer just two of them to you that the Care Coordination Collaborative reinforce and exemplify. One is the challenge of early detection leading to referral, leading to linkage, and linkage requires care coordination, as we know. And the second is the need to continually be thinking about expanding the quote-unquote system outward, from child health services to early care and education, family support and child welfare, to the multitude of sectors that represent basic needs. And then finally, you did get some glimpse of how to best implement, operationalize this concept, and I think Susan's description of micro and macro levels is really helpful. So the notion of discussing and sharing cases as a vehicle by which to bring all the various care coordination entities together and see value in what each other are doing. The utility of the partners tool and really mapping out relationships and identifying where the strengths are as well as where the gaps and opportunities are. The sharing of resources and the training opportunities which Mary Jane and Susan described. And then there are really the big macro levels and the opportunity to reflect on and really impact policy gaps and systems level issues. So to wrap up, I think that the Care Coordination Collaborative is really a great example of what we always stress in our Help Me Grow replication work. That on the one hand, there's the basic intervention or innovation, in this case, the Care Coordination Collaborative, its core components, its structural requirements, and it's the direct effect that it's having on children and families. And then in addition, just like with Help Me Grow replication, there's the system building aspects. And we always stress when we're asked to define what do we mean by system building, and I suspect that everyone on this call would probably define it a little bit differently, but I would also suggest that everyone on this call would incorporate care coordination somewhere within that definition, both care coordination within a discrete sector like child health services as well as cross-sector care coordination. And again, we found the Care Coordination Collaborative an extraordinary vehicle by which to build that capacity to enable our system building to promote children's healthy development. So we hope that you will give this opportunity careful consideration, and we're pleased to provide any further information.
Thank you, Dr. Dworkin, and thank you to all of the presenters on today's webinar. A few reminders before we close. The Help Me Grow National Forum is taking place April 15th, 16th, and 17th, and we do want to remind all affiliates that the registration will close this weekend. So if you have started your registration and need to go back and finish it, we do encourage everyone to do so. And the Overflow Hotel, the Wyndham Costa Mesa, the information for that is on the forum event website. If you have any questions, please feel free to contact us at Help Me Grow National. We are happy to send that information to you and again provide the link. At the forum, we will have a Care Coordination Collaborative breakout session with wonderful information on the ongoing first cohort for this collaborative and also general information about the Care Coordination Collaborative. And we also want to remind everyone at the end of this webinar to please complete the survey. And again, let us know if you have any questions or need any other information on Care Coordination Collaborative before submitting the letter of interest, which is due March 31st. Thank you for joining us this afternoon, and we hope you have a wonderful day.